Hi students, I am going to go through your assignment. Make sure you review the rubric so you understand how I'm going to deduct points. Incorrect principal diagnosis, incorrect principal diagnosis description, secondary diagnosis. Make sure with that, I want you to know, differentiate between those secondary diagnoses. It's really important. So we also add descriptions of those symptoms or conditions that are inherent in the disease process. So let's go ahead and start off with this chart. So our principal diagnosis here is going to be the syncope and collapse, R55, and we'll talk about this here. The secondary diagnosis is going to be the tobacco abuse, Z72.0. Keep in mind, on the discharge summary, it states there was no seizure activity noted and there was no positical period. So per notation in this assignment, if you go to chapter 6, which is on page 53, 54, towards the bottom, it tells you right there, caution should be used in coding uncertain diagnosis of conditions such as epilepsy, HIV, and multiple sclerosis as if they were established. Okay, this is really important because I know, the beginning of this, it talks about inpatient, where if it's inpatient and it says possible appendicitis, you can code it. But there are some instances where you cannot code it because these conditions listed right here can have very serious personal consequences for the patient. So the coder should consult the physician, which that's going to lead to our physician query. Okay, so therefore this is an excellent example how we should query to start that discussion with our provider physician. We have the G code for epilepsy, we have the convulsion disorder. They should not be done until this is confirmed by your attending physician. Also, the patient did not have any EGY in the hospital. She's being discharged and they scheduled to have that one done the next day. So keep in mind, it's very important that you look at the dates that the patient was actually in the hospital. There's another reason why we would not use the diagnosis of seizure because they didn't do those extra procedures to diagnose it. And one other thing, a few of you had worsening cold, which it was documented in the discharge summary, but because that condition, it wasn't treated or medically managed during that inpatient admission, you can tell when a condition has not been treated or managed upon reviewing the physician's progress notes, such as in this case, which do not include any documentation about that patient's response to treatment for a worsening cold. That's because really no treatment administered besides some Tylenol, but that does not support assignment of a code. So if anybody has any questions on what should be coded, just make sure you listen to my video once or twice. Really review page 53, page 54 in your textbook. It really does make sense. And I think this is a great learning assignment. So reach out if you have any questions.